Members, before we reconvene in the examination of these items, I just wanted to say that, we're just running really behind in getting through these appropriations. I recognize and know that members, want to ask questions. But what I am asking is that we could try to make more judicious use of our time and try to get through some of these appropriations. Otherwise, we will be here till 2 o'clock in the morning. Well, hopefully that may spur us on a little bit more, but we do have a whole lot more to get through. And I reckon some of these things, as we move through, will not be, attract much questions and stuff, but I'm just asking members to be particularly cognizant of that fact that we are making really slow progress here this evening today.
Mr. Chairman, whilst I know that the Minister for Education is not on the floor right now, but a very topical issue that I believe this entire country knows about by this time is the issue surrounding the Eastern School, which occurred today. I attended that incident, that concern this morning, and I was presented with a letter petition that they asked me to present to the minister. And I don't think they wanted me to do it publicly, really. I crave your indulgence to allow me to hand that to the Minister of Education. It surrounds the school and the provisions for teachers in the school. And whilst we may criticize the methods that were used today, we also have to look back at the history of what has happened to that school. And therefore, I would like to just ask you all to look at it, and the country to look at it objectively, first of all, and ask the minister to transmit this petition letter on to whomever must get it for action, because the situation is not going to get any better anytime soon unless some real decisions are made. Okay. I thank you, sir.
Let us move on to HEA 12, Mental Health Services, in the amount of... Oh, sorry, ma'am.
You move on, may I beg your indulgence to respond?
Please, ma'am.
Thank you. I'll make it brief. The member from Easton obviously brought it to my attention. I did attend the district of Easton this morning to find that both gates are chained and padlocked, even as we speak. No children or teachers were allowed to enter therein, so it's a whole day without any of the classes getting being educated. I do understand the sentiments of the people of Easton and the member from Easton, but as this House would be fully cognizant under Section 55 of the Constitution, civil servants are under the ambit of Her Excellency the Governor, which has been delegated to the Deputy Governor. So I would be happy to take the petition to the person responsible, which is my esteemed Chief Officer. It's already been brought to his attention, and I've gave the instructions this morning that we need to get a teacher in Easton, even if that meant that I went and sat in the classroom and taught again until the 22nd, which was the date intimated that they would get a teacher.
Okay. Thank you, ma'am. HEA. Don't cross the floor, sir, please. HEA 12, Mental Health Services, $2,731,204 in 2018 and $2,731,204 in 2019. Are there any questions? If there are no questions, I put it to the floor. All those in favor of HEA 12, Mental Health Services, $2,731,204 in 2018 and $2,731,204 in 2019, standing part of the schedule to the bill, please say aye.
Aye.
And those against, no. The ayes have it. HEA 16, Geriatric Services, $615,364 in 2018 and $615,364 in 2019. Are there any questions? Member for Newlands.
Just a quick question, Mr. Chairman. How is access to the service given? Is this done directly through the HSA, done through NAU, or which agency?
Mr. Chairman, through you, the access to the geriatric output, or older persons output as we are asked to refer to it now, is through an in-house assessment process. If the individual is deemed to fulfill the criteria of the indigent output, then we will move them over to that output in due course once the assessment is completed.
Thank you. And I'm assuming that the criteria is similar to that used by NAU?
Through you, Mr. Chairman? Yes, sir.
Okay.
All those in favor of HEA 16 Geriatric Services for $615,364 in 2018 and $615,364 in 2019, standing part of the schedule to the bill, please say aye.
Aye.
And those against, no. The ayes have it. HEA 17, Medical Care Beyond Insurance Coverage, uninsured, $1,170,000 in 2018, $1,170,000 in 2019. Are there any questions?
One question, Mr. Chair.
Member for Georgetown Central.
Where it says / uninsured, does that mean and the uninsured? Yeah? Okay, thank you.
Through you, Mr. Chairman? Yes, sir.
Yeah.
It's uninsured or underinsured.
Yes. Member for East End.
Thank you, Mr. Chairman. We're talking 3, 6, 7, 4, 5, 6, 8, close to 10,000 visits per year.
Is there a question there? Member?
I'm asking, is this right that we're talking close to 10,000 visits per year? And Mr. Chairman, may I just, while we're doing it, number of emergency visits at A&E, 1,800 to 2,400, and taking the lower end, 1,800. Number of visits to general practice, 3,750. Number of specialist clinic visit, 3,500. Total number of, natal visits, 1,000. Total number of family planning clinic visit, 300, 600. That's 10,000.
Mr. Chairman, through you, this is on a demand-based services. So basically, we provide the services for whatever category that are required. But those are the categories that would be required for those. Right, it's encounters, not necessarily patients, Mr. Chairman.
It's in what?
It is encounters. It's the number of times a patient would go to be seen rather than the number of patients. Could it be the same patient that is going more than one time?
So we may be looking at, say, 6,000 then.
It varies depending on what the demand is, Mr. Chairman.
What I'm trying to look at is the fact that there are so many people underinsured or have no insurance coverage.
Mr. Chairman, through you, I think what the point is well taken, that it doesn't necessarily mean that all the persons that access this output are uninsured, but perhaps they are underinsured. So perhaps they may have the SHIC insurance plan, or they may have a copay or a deductible that they are unable to make. So there are a number of varying circumstances why persons may fall under
And
this output.
antenatal as well, we have that for?
Through you, Mr. Chairman, that's correct. We provide services for antenatal services that are uninsured.
You can't have single mothers without fathers.
All those in favor of HEA 17, medical care beyond insurance coverage / uninsured, for $1,170,000 in 2018 and $1,170,000 in 2019, standing part of the schedule to the bill, please say aye.
Aye.
And those against, no. The ayes have it. HEA 18, school health services, $1,470,445 in 2018 and $1,470,445 in 2019. Are there any questions?
Mr. Chair.
Member for
Just-
Georgetown Central.
Thank you, Mr. Chair. Through you, can I just get an explanation of where these services and how they are implemented in respect to the schools?
Mr. Chairman, through you, we have, there are 22 schools at the primary level and a similar number of preschools on island. And the student population is actually in excess of 7,000. And the services that are provided through this school health output is by a public health nurse and 4 registered nurses. 2 of the registered nurses are actually based in clinics at the Clifton Hunter High and the John Gray High, and they provide the full scope of school health services, which is immunization, screening, first aid, and health education. The other 2 RNs are responsible for the private and public schools in Georgetown, Prospect, Red Bay, and Savannah districts. And they provide screening and immunization as well as health education. And the public health nurse is responsible for the SciFec campus and the preschools. The public health nurses in West Bay and Boddentown, they supplement the school health services by supporting some of the activities in the schools in their relevant districts. And that could be anything from screening to immunizations. And this is done as well by the school health coordinator. And then when it comes to school entry screening, that is something that is done jointly by all of the school health nurses as well as a public health nurse.
Thank you, Mr. Chair.
Mr. Chairman, thank you. I notice here it says Bordentown Health Center for dental services. Does that mean that Bordentown Health Center covers Savannah and Bordentown Primary?
Mr. Chairman, through you, can you just clarify the question a little bit? Are you talking about school health services still?
Yes. We're down in location, school dental service.
For dental services, correct. Those are provided out of the Boddentown Clinic.
For
Mr.
both
Chairman.
schools?
Yes, sir.
Okay. Another question, Mr. Chairman. The Savannah Primary, no, Bordentown Primary. I've had complaints, numerous complaints, that there really is no medical care for students there. And I think this is the same situation in Savannah where there's no full-time nurse at either school. Isn't there a requirement for us to provide a nurse once the school is above a certain size in terms of number of students?
Mr. Chairman, through you, actually WHO requires a certain ratio of students to school health nurses, and that is something that there's a growing demand because there's a growing number of schools, growing number of students. And currently in the Eastern Districts, we are providing that service, but it's not a school-based clinic per se. The relevant services are provided on a visiting basis to those schools. But through you, Mr. Chairman, to the member, we have identified that is a growing need, and we've been in discussion with the ministry in regards to expanding that output in the future.
Thank you, Mr. Chairman. And will that be reflected in this budget?
Mr. Chairman, through you, no, that's going to be in a future budget. In this budget, we will continue with the provision of the services as we have in the last year, where we're providing the services to the schools on a visiting basis.
Mr. Chairman, I don't think that it's acceptable that we wait 2 years for that need to be addressed. I have real concerns, and we actually had concerns when we visited Georgetown Primary as well. Teachers are taking on the profession of nursing, and these are kids we're talking about. They're kids who come to school with various ailments that are infectious, and the teachers are treating them and dealing with them. And I really don't think that something this urgent should wait 2 years. That's one thing I'll ask the government to please find a solution for. These are kids. They need the assistance.
Mr. Chair, if I can just give my support to that, because I got the same complaint in Georgetown.
Member for Georgetown Central, I have to give way to the member from Savannah for.
Yeah, mine is
and
just
then to Minister.
mine is just
Minister.
echoing what he said, and just a reminder that Savannah is up to 400 native students, so the need is there, and Bordentown was really pleading for some help. But I give way to Madam Minister.
Thank you, Mr. Chair. In addition to concurring to what was just said, I just wonder if the lady could indicate to the committee when these discussions commenced.
Mr. Chairman, through you, we've had the discussions during this budget period leading up to the SPS. We've been in discussion in regards to the needs. Having said that, I mean, obviously there's a finite, part of resources, and this is something the ministry will be addressing.
I'm sure that the minister would agree that this is a 2-year budget, and as indicated, is a very significant need. Can a commitment be given that it will be looked at as a matter of emergency? Because as the member from Savannah said, I just got through visiting schools last week, and there's a dire need for this attention, and prevention is much better than cure, so I would ask that some urgent attention be given to it.
Mm-hmm.
I put the question. All those in favor of Minister?
Just to add to that, I agree with the member from Newlands. 2 years is a long time, and I undertake that to see that this is remedied before the 2-year budget cycle.
Okay. Member for Georgetown Central. Yep, okay. All those in favor of HEA 18, School Health Services for $1,470,445 in 2018 and $1,470,445 in 2019, standing part of the schedule to the bill, please say aye.
Aye.
And those against, no. The ayes have it. HEA 19, Medical Care for Chronic Ailments, $775,608 in 2018 and $775,608 in 2019. Are there any questions? There are no questions. All those in favor of HEA 19, Medical Care for Chronic Ailments, for $775,608 in 2018 and $775,608 in 2019, standing part of the schedule to the bill, please say aye.
Aye.
And those against, no. The ayes have it. HEA 20, public health programs, investigations, and treatments, $2,035,909 in 2018, and $2,035,909 in 2019. Are there any questions? All those in favor of HEA 20, Public Health Programs, Investigations, and Treatments for $2,035,909 in 2018 and $2,035,909 in 2019, standing part of the schedule to the bill, please say aye.
Aye.
And those against, no. The ayes have it. HEA 21, Medical Internship Program, $150,000 in 2018 and $150,000 in 2019. Are there any questions? If there are no questions,
No,
oops. Go ahead, sir. Oh, okay. Member from East End, you go first.
thank you, Mr. Chairman. Mr. Chairman, I wonder, is this the the program we have at the University of West Indies?
Mr. Chairman, through you, this output provides medical internship for those physicians post-medical school training for 2 years. So in 2012, we were examined by the CAMC and were accredited to be able to provide the internship and SHO training at the HSA.
And these are Cayman doctors coming back?
The internship program is actually, the agreement is that we cannot discriminate in regards to the nationality of the doctors that are coming here. However, it is a reciprocal program, so Caymanians can go and get placement over in other jurisdictions as well. And in so doing, through you, Mr. Chairman, it actually is beneficial for Caymanian doctors to go to other jurisdictions to get the training, because it gives them additional exposure to the type of cases that they would see in another jurisdiction.
So we qualify to have 3 at a time?
Mr. Chairman, we're actually qualified to be able to have 7 persons at a time. We're funded to have 3 in the program at a time.
So we have to fund it. The Cayman Islands has to fund those doctors, those interns.
Mr. Chairman, through you, yes, and if the Caymanian goes to an overseas facility, then that's a reciprocal relationship with the other jurisdiction. And to date, we've actually trained 13 interns, and those are Caymanians, and 10 of them have actually been accepted in postgraduate training. And the universities that they're at is actually very pleased with the level of training that they have received here in our CAMC program.
Okay, how many do we have doing intern elsewhere?
We, Mr. Chairman, through you, I think currently we have 2 in Jamaica doing their SHO level over there.
Mr. Chairman, have we explored I think it was Bahamas, that we just came online some time ago or something. Have we explored them going to Bahamas?
Mr. Chairman, through you, our medical director is currently in dialogue with the medical director in the Bahamas in regards to the possibilities over there. And then we also have one now actually in Trinidad as well, the University of the West Indies in Trinidad.
And we have 13 doing post professional qualifications, you said.
We have 10 that have been through 13 that have been through the program, and 10 that are in their specialist training at the moment.
Are there any others waiting to go into specialist training?
Mr. Chairman, through you, yes, there are others that are waiting. They're in their second year of training, and they're waiting to get approved through the scholarship process.
How many is there? How many?
Mr. Chairman, through you, I don't have that number on me right now, but I can endeavor to provide the House with that number later on.
Okay.
Member from Savannah, did you have a question? No? Okay. All those in favor of HEA 21 Medical Internship Program, $150,000 in 2018, $150,000 in 2019, standing part of the schedule to the bill, please say aye.
Aye.
And those against, no. The ayes have it. HEA 23, provision of antiretroviral medication, $942,000 in 2018 and $942,000 in 2019. Are there any questions? Member for East End.
Mr. Chairman, just briefly, does there seem to be an increase in the incidence here?
Mr. Chairman, through you.
Yes, ma'am.
Actually, the data has been pretty static over the last number of years. The total cumulative HIV infections is 153 persons, with those persons who have converted to AIDS is 75. So we have, the numbers have pretty much been static over the number of years.
Well, I see only 30 getting medication. Should that have been 130?
Yeah, Mr. Chairman, through you, the output is actually 4 Caymanians that are being treated, whereas those numbers that I just gave you are total, the total number of persons that have been diagnosed with the illness.
So the question that begs then, are we monitoring the others, or are they on treatment? Because from 153, that's 4 minus from minus taken away from 153 is 149.
Mr. Chair, through you, the number of people that are currently living on island with HIV is 69. So the figures that the CEO quoted earlier were the cumulative total since we've been tracking. So we currently have 69 people living with HIV, 43 males and 36 females. The Public Health Department does track those patients, whether they're Caymanian or not. They do have interactions with them. A number of them, and as members will be or may be aware, one of the screens that comes with work permit applications as well, part of the medical, is an HIV screening too. So the number of cases currently on island is 69, which will reflect Caymanian and non-Caymanian.
Mr. Chairman, are those work permits, or I thought that was one of the screenings that would not allow them to come here?
Mr. Chairman, through you, these will include individuals who will have been diagnosed after they've arrived on the island, so perhaps they didn't have it when they arrived and they've since developed it, but they would have been screened through the work permit process, but there are instances where people have been diagnosed after they've come.
Mr. Chair, through you, and I hope I don't sound insensitive because I've already got an article written about me since yesterday about being insensitive about questions. So, my question then being that there are people here who are on work permit who have HIV. When the renewal process happens, I mean, I know that this is more of an immigration matter, but unfortunately it's come up now. When that renewal comes in, what's the practice then? The only reason I asked this grouping, because I know it's immigration matter, but they may be aware of the policy after that.
I would say that this group, this Ministry of Health, would not be in a position to answer a matter relating to the immigration department and the policy followed there with regard to the grant or refusal of a work permit as such. Am I correct? Am I thinking? Okay.
Mr. Chairman, with all due respect, sir, the Ministry of Health must be notified of any such diseases diagnosed in this country.
Chief?
Mr. Chair, through you, the member is correct. This is a reportable disease. It's required by law, under public health law, to be reported to the medical officer of health by the practitioners if it is diagnosed.
Yeah.
And they do then report to immigration in the case of a work permit holder.
So I'm assuming by process of elimination, to answer my question, then that once they reapply or the work permit is up, they don't get another one because you have to be free of that disease when you're applying for it in the first place. I know these questions are difficult, so I'll just, if they're not going to get an answer, I'll move on to the second one. Worth a follow-up, but through you, Mr. Chair, Ms. Ahern, the chief officer, I apologize for the ministry, said the number of persons with HIV is 69. Can you verify the number of persons who've been transmitted to AIDS? Yeah.
Oh, 7 to 5.
Mr. Chair, through you, I would have to provide that. I don't have that figure, the distinction between HIV and AIDS right now, but I can give an undertaking to get that information for the member.
Okay, thank you. And just for confirmation, it was 43 males and 26 females?
Mr. Chair, through you, the information I have is 43 males, 36 females.
Well, that wouldn't be 69, then that would be 79. 79. Okay, thank you, Mr. Chair.
All those in favor of HEA 23, provision of antiretroviral medication for $942,000 in 2018, $942,000 in 2019, standing part of the schedule to the bill, please say aye.
Aye.
And those against, no. The ayes have it. HEA 24, provision of psychological trauma diagnosis and treatment for children, $100,000 in 2018 and $100,000 in 2019. Are there any questions?
Mr. Chairman,
Yes.
is this sufficient? $100,000 a year, to me, doesn't seem to be enough to provide support to abused children, given the number of incidents that I read about in the newspaper.
Mr. Chair, through you, if I could just, the This funding and the post under this funding is actually working with the multi-agency safeguarding hub that was recently established, which is a partnership with the HSA, the Department of Children and Family Services, the RCIPS, and they're basically a task force that are all working together to try and address the issue. So in terms of what is being spent to protect and provide treatment in this area, this is just one of the outputs that's contributing towards it in the overall picture for government.
So in terms of diagnosis and treatment of trauma, are there other avenues for these children? Or is this the only one as part of that hub?
Through you, Mr. Chair, this is, there's other, so this is specific to this type of trauma. There are other, through the mental health services at the hospital, and the CEO can speak to that. There's other mental health services for children and adolescents as well.
And you're, through you, Mr. Chairman, are you confident then that this gets the job done?
Mr. Chairman, through you, if I may respond, this output is really a partnership, as the chief officer said, with other government agencies as well as the hedge fund CARE. They have supported that program from the inception. From 2010. So essentially, we are providing the manpower in order to look after the children that are faced with these needs, and any ongoing assistance will be provided through other relevant outputs. But currently, we agree with you that there is definitely a growing demand in this area, but we're meeting the needs at this point in time with the service level that we are able to provide with all of the other agencies that are working with us under this program.
Okay, that's all I needed to know. Thank you.
All those in favor of HE 824, provision of psychological trauma diagnosis and treatment for children, $100,000 in 2018 and $100,000 in 2019, standing part of the schedule to the bill, please say aye.
Aye.
And those against, no. The ayes have it. HE 825, management and maintenance of cancer registry, $38,666 in 2018 and $38,666 in 2019. Are there any questions?
Mr. Chair,
Member from Georgetown Central.
just from an informative perspective to educate myself about this registry, because obviously a while back there was some hoopla about it. I want to know whether or not, obviously the information that is collected has no names attached to it, that I'm aware of. But the information and the data that is collected over a period of time obviously becomes valuable, particularly in the research field. Is it something that the government is prepared to make revenues from in the future? What is the overall long-term plan, or is it simply only for our physicians here to focus on, for our own education? Or is it something that not even necessarily for a profit, but to share with the rest of the world if we find good findings or the like?
Mr. Chair, through you, I can say to the member from Georgetown Central that this is on a voluntary basis only. I can also say to you that I don't have personally an appetite for it to be mandatory. No, I just gave my opinion. Yeah.
You have something else to add, Chief?
Sorry, Mr. Chair, just to answer the member's question regarding the government's plans with the data and whether we plan in the future to sell that data, that certainly isn't the case at all. The information in the cancer registry, which, as the member noted, is anonymous, is intended to try and help us get a better picture of the situation in the Cayman Islands with regards to the prevalence of cancer. The difficulty that we have, because it is voluntary, we do have to rely on members of the public to report. So the data set that we have is incomplete, and it's difficult to draw statistically significant conclusions from it. However, it does give us some indication based on those people who have reported the types of cancer that we're seeing in the Cayman Islands. And I guess I would be remiss not to use this opportunity to encourage everybody whose friends or family members or themselves may have had cancer to please reach out to the cancer registrar and get your information in there. It is anonymous, and one of the benefits long term that we can see as a country if we have a more complete data set is we'll have a better idea where to invest our resources in terms of prevention efforts, treatment, and care.
Mr. Chairman, quickly, are we now working with the Brain Tumor Foundation in terms of updating this registry? I know there was some difference of opinion on how it should be done, whether or not benign brain tumors should be recorded in this registry. Have we resolved that, or are we still in conflict?
Mr. Chair, through you, I think the member's referring to when the draft legislation was out for consultation in the previous administration, and there was some discussion around whether brain tumors would be included as a reportable, a mandatory reporting by the physician. The legislation hasn't progressed, and the registry now is voluntary. So it's really up to individuals if they want to report their tumor, whichever kind they might have.
And well, I guess that answers my second question, which is the difference between benign and malignant brain tumors. I think that the Brain Tumor Foundation's opinion was that even benign tumors should be reported because they can be a precursor to a malignant tumor. So that was their position, but I'm assuming that none of that has been included and incorporated into this, based on what you just said.
Mr. Chair, through you, the proposal in the draft legislation that was out for public comment was to include benign brain tumors because the view of the clinicians was that they are often a precursor for malignant tumors. But as the legislation hasn't progressed into law, it still is just a voluntary registry. And so people are encouraged to get their information in there.
Thank you, Mr. Chairman. Just, I would encourage the minister to, I mean, I understand making things mandatory comes with certain implications, but I see this information as really relevant in terms of prevention later on. So we need to strike some sort of balance here. I know the medical professionals need the data in order to predict and look at trends and so on. So, I would encourage you to approach this one with an open mind.
Mr. Chair.
Minister.
Yes, and we all know we're living in the Cayman Islands, the beautiful Cayman Islands, and as much as we would have liked to have advanced, we still have a lot of taboo subjects, and this seems to be one of them. I've had many people call me, so I'm not just saying it on my behalf personally. There's a lot of people that represented to me, and I've had a lot of conversations with persons who prefer not being mandatory. So I'm mindful, and I take on board what you said, but we have to walk carefully with this one.
I put the question.
Mr. Chair, just before you take the vote, I know that this is the last one for the HEA, and I am assuming that the minister is going to let go of these lovely civil servants who's been so patient with us. I just want to say thank you so much. You've been patient for annoying young people like myself. Thank you.
Question is, all those in favor of HEA 25, Management and Maintenance of Cancer Registry, $38,666 in 2018 and $38,666 in 2019, standing part of the schedule to the bill, please say aye.
Aye.
And those against, no. The ayes have it.
Mr. Chair.
Minister.
Thank you, Mr. Chair. This brings to the end the HSA's questioning, and I want to, at this time, before the night runs high. I thank the Director of Departments of DEH, Council Services, members working with the ISVIM program, MRCU, and the HSA for all the hard work that they do in service to this country and for their patience today. Thank you very much.
Thank you.
You can go now.
We now turn our attention to the museum, in which there are three appropriations to that. Primarily could have an indication as to what members are with regard to questions. Do they have questions about the museum? And okay. So can I take these appropriations collectively, or would you prefer to do so individually?
Mr. Chairman, I'd be happy for you to do them collectively.
Thank you very much. I appreciate that. Okay, so MUS 4, Collection and Preservation of Significant Material Evidence, $147,744 in 2018, $147,744 in 2019. MUS 5, Museum Facilities, Exhibitions and Displays, $541,928 in 2018 and $575,928 in 2019. And MUS 6, Provision of Policy and General Advice on Museum Matters, $131,328 in 2018 and $131,328 in 2019. Are there any questions?
Yes, Mr. Chairman. Just on the collection and preservation of significant material evidence, is this limited to the museum, or is there scope for other groups and organizations to be supported by this?
Mr. Chair, through you, this output funding is for the museum. It's specific to the museum.
Does the museum, Mr. Chairman, does the museum work with other groups? I'm thinking specifically of the ladies up in Bordentown that at the Heritage House, right?
Yeah.
Mission House,
Mission.
who have a large number of artifacts that they have
No, that's
collected.
Nurse Joseph's. Nurse Joseph's.
Yeah, the Nurse Joseph Center. They've collected them, they've preserved them, but they're doing that all in their own time with no financial support, really. And it's amazing what they have gathered there, but I'd like to see some more, at least partnership with the museum to not to take over maintaining these artifacts, but in helping with the process of preserving them and guiding them, giving them advice and so on.
All right. Before the director speaks, I would like to say that I support the comments of the member from Newlands.
Peggy Leshiker Denton, director at the National Museum. Very pleased to be here. Mr. Chairman, through you, the reply there is yes, this output is specifically for the National Museum. We do have the collection of over 9,400 objects that we care for regularly. But we do have regular partnerships with all of the cultural organizations, so we welcome further collaboration. And I have spoken with some of the folks over in Bordentown about their collections. We work regularly with the National Gallery, with the National Trust, with CNCF, who all have collections. And so, yes, we thank you.
Thank you. And in terms of what you do within the community, do you provide education, showcasing, whatever sort of programs that are out there for people to be more aware and involved in the work of the museum?
Through you, Mr. Chair. Yes, we have pretty vibrant educational programs. The museum itself is our biggest featured attraction. We welcome school children from all districts to the museum. We give regularly scheduled tours. Teachers just have to call us, and we do that. We have a speaker series. We have street closings where we feature, we call it a look ya, and we'll be having a big one in November. So we invite people from all of the different districts to bring cultural items that they have created, as well as food, to share in the districts. And so we very much like to reach out to children, as well as we take fam trips for the Department of Tourism. We introduce all new civil servants to the culture through visits to the National Museum. And then just that's our, what you see the public face, but of course behind the scenes we have this great collection. So we have research opportunities for young people.
Okay. And thank you, Mr. Chairman. Through you, I know that a number of the artifacts were damaged, I think in Hurricane Ivan. Have we managed now to restore and preserve those, or are we still working on them?
Well, we do not have a conservator on the staff. Oh, Mr. Chairman, through you, we do the best we can. There have been a few objects which we have had to deaccession. These were things like some of the straw work, some of the basket work. Fortunately, we have living people who have been able to. We've been continuously collecting in that area. We do have other objects that have been affected. We would benefit greatly by the ability to hire a conservator, and it is one of our aspirations. We're at about a kind of a level budget right now, but we're trying to do the best we can, and could use assistance in those areas.
Thank you. And Mr. Chairman, through you, are we in a time crunch to get that person on board? Are the artifacts continuing to deteriorate, or are we doing enough to sort of keep them static for now?
Mr. Chairman, through you, it would be a great benefit to the museum to be able to hire a conservator.
Okay.
And to the country.
Thank you. Mr. Chairman, the last question is just on succession planning, training of Caymanians, because I know this is for some, this is an exciting and interesting area to work in. What are we doing about making sure that we attract more Caymanians into this line of work?
Mr. Chairman, through you, well, we do have two senior level staff who we've offered a museum management training. One of them has completed it, the other has not at this stage. We have just, we've brought on board two young people in design and education events, and we've sent one of the young professionals off to the Museum Association of the Caribbean meeting in Miami recently. One of our other senior staff went to Cara Festa in Barbados. So we very much aspire to training. Again, we definitely need more professional staff. We're doing pretty good. We're holding our own. But we very much supported the National Culture and Heritage Policy, and we did aspire to increase our budget, not just the museum, but I believe all the cultural organizations have aspired to do that. We've been told to sort of hold our own on a level line, which is what we're doing, but we do all have very concrete other projects that we put forward should the funding be found somewhere.
Thank you. And you just made me think of another question. I'm sorry. Through you, Mr. Chairman. Do you get private sector support?
Mr. Chairman, through you, we do reach out for private sector support. We and even other governmental support. One of our best exhibits right now, we collaborated with the Department of Tourism, and so we have a really fine exhibit that they're promoting that they essentially assisted pay for. Our 25th anniversary exhibit, we had a number of entities, on the island who supported us and became our sponsors. So we're always trying to gain additional funding where we can, and we're getting more successful at it at the museum.
Thank you.
Mr. Chair, through you.
Member for Georgetown Central.
Thank you, Mr. Chair. To the director of the museum, in this allocation for the just over $500,000, is there any provisions in that for? I know that the museum was looking into trying to find a facility because you're currently renting to protect your items for the museum, and that's becoming, from a long-term perspective, rather costly. And from 2014, I know that there was a plan from then to try to, over a period of time, find a location. And I think that you guys created a strategy or a plan for it. Is any allocations in this for that, or is that plan still on board?
Mr. Chairman, through you, in the last budget, we were granted $240,000 towards this facility. We are in the process of working on an outline business case and have put forward, because we've had assistance from Public Works, but have not completely created the outline business case yet. So we have not been able to move as fast forward as we would like to. We would like to have sort of a commitment of staggered years of funding to reach a certain goal. We did, in the preliminary request, put forward a proposal for capital funds for such a project, but capital funds at this stage have not been, are not necessarily available for us, but we did put forward a plan for that. And should capital funding become available for the museum, I'd be happy to elaborate.
Through you, Mr. Chair, I am aware of that request for funds from 2014. We're now in 2017, and we're now looking at the budget for 2018, 2019. So from 2014 now, you're saying that if it's not in this budget, that means it's going to be another, 2 years before you guys address that problem of the protection of those items? I'm sorry for putting you in that position, but I'm highlighting the obvious because I know that this is something important to the museum in respect to having a facility to protect those items that we consider the things that identify us as Caymanians. And I know it's a priority for the museum for some time, from 2014, and it still hasn't been allotted for in any of these budgets. So I'll rather than saying a question, I'll say a comment. I think it should be a priority to give the commitment for the museum to secure the things that make us who we are.
I put the question. All those in favor?
Mr. Chairman,
for
briefly, sir. There was a proposal many years ago to go into East End proper, East End land, deep end land, because government has much land in there, and build a couple 100,000 square feet of property for the archives and the museum. That is something I think we need to pursue. We really need to pursue that. That would, and it only needs a building, really, four gray walls and built to hurricane standard. Someday I hope we do that. But I would just like to thank you for your help with those signs with Ms. Reed for me. If I can get that money from my good friend, my number 2 good friend, been reduced now.
all those in favor? of MUS 4, Collection and Preservation of Significant Material Evidence, $147,744 in 2018, and $147,744 in 2019. MUS 5, Museum Facilities, Exhibitions, and Displays, $541,928 in 2018, $575,928 in 2019, and MUS 6, Provision of Policy and General Advice on Museum Matters, $131,328 in 2018, and $131,328 in 2019, standing part of the schedule to the bill. Please say aye.
Aye.
Those against, no. The ayes have it.
Block vote again.
Next set of appropriations is NCF 7 and 8. Can I have an indication if
Mr.
members
Chairman.
mind if we take it together?
And 7. Just want to make a comment, really.
Okay. I will open it up for questions. NCF 7, Arts and Culture Presentation, Documentation and Promotions for $99,873 in 2018 and $99,873 in 2019. NCF 8, National Festivals and Stage Productions, $498,536 in 2018 and $498,536 in 2019. Are there any questions? Oh, let me include, I completely misread, members, NCF 9 as well. NCF 9, Training and Support for Artistic Development, $61,591 in 2018 and $61,591 in 2019. Are there any questions?
I just have a question, and not a question and a comment in reference to the national culture and heritage policy. I was dumbfounded and never did understand why, when the committee was formed, I know the individual was requested as ancillary support. Dr. the Honorable Mayor Lawrence, who is the preeminent culture and heritage person of the Cayman Islands, was not on that committee. There's no one, and I'm sure that my Bordentown colleagues is aware of that knows more about the history of culture and heritage in these islands, and yet she was not on that original committee. I just wondered why.
Mr. Chair, I concur with the member from Savannah. I just want to add that I myself has scheduled a meeting with the good doctor, and because I need some information from her that I think she's the only person I could go to, and preservation of some sites in Bordentown. So I really concur with what the member said.
Mr. Chairman,
Yes, sir.
probably this is a good time for me to say this here, but I certainly agree with the statement that Dr. Lawrence is, and the former speaker, is preeminent in understanding and knowledge of Cayman culture and certain political circles. In the next 2 years, we'll be, as the Premier had announced, that the government will be recognizing the two important times, our coat of arms and our Constitution. And we've already talking to Dr. Lawrence, the former speaker, in regards to doing a book. Not a huge writing, but sufficient enough to record. May be a good tabletop. Record the history of the legislature and its works, and from the beginning to present. And so we will be working on that, and she will be doing that.
Mr. Chairman, I'm very happy and pleased to hear that. And if you want to know the type of work she done and has done in putting it in in black and white, what she did for Caribbean Utilities, that was an outstanding job. And I cannot understand for the life of me a woman of that caliber and knowledge why we as a government or whoever the government is at some stage don't employ her in writing some of the history and what has happened in the Cayman Islands. She is just a wealth of knowledge, and I would encourage the government to utilize her to the fullest.
Well, I just would like to say, don't give her too much now, because I was certain, and I know the government is going to appreciate the work that you do in recording the works and the development of our parliamentary process.
Thank you, members. I put the questions. NCF 7, all those in favor of NCF 7, Arts and Culture Preservation, Documentation and Promotion, $99,873 in 2018 and $99,873 in 2019. NCF 8, National Festivals and Stage Productions, $498,536 in 2018 and $498,536 in 2019. And NCF 9, Training and Support for Artistic Development, $61,591 in 2018 and $61,591 in 2019. All standing part of the schedule to the bill. Please say aye.
Aye.
Those against, no. The ayes have it. The next three appropriations referring to the National Gallery, NAG1, NAG2, and NAG3. I propose we can take them collectively and examine them as one. NAG1, Exhibitions and Collections, $169,940 in 2018, $169,940 in 2019. NAG2, National Art Collection, $120,620 in 2018 and $120,620 in 2019. And NAG3, Art Education and Outreach Programs, $295,440 in 2018 and $295,440 in 2019. Are there any questions? Member for
Mr. Chairman, I just need to know if Ms. Lass's collection.
No, go ahead, sir. Go ahead.
If Ms. Lass's collection is stored at the National Gallery.
No.
Mr. Chairman, through you, most of Miss Lassie's collections actually the Cayman National Cultural Foundations. But I'm aware that they do allow the gallery to exhibit her works in the gallery.
But why is, Mr. Chairman, why is that when we are saying the national collection is displayed at the National Gallery facility? The national collection? And we have it split all over the place? Is it, and maybe this is for the minister, maybe, I don't have a problem with prints, but the originals need to be placed in one place. And if the National Gallery, that's our quote-unquote point of focus for all our art, then that's where it must be stored. Why don't we just take this thing, if it is presented to us from it, Mr. Chairman, I'm very sensitive about Ms. Lassie, house, because it was through our ministry, our administration, that we had to go and find $200,000 each of the ministries, our ministries, to buy Miss Lass house for $1 million. So don't think anybody else did that. We have that man up there, South Sound wanted us to give him the public beach and he would pay the $1 million, not him, not one grain of sand off South Sound Beach. That's how that was bought. I would like to see the National Collection at the National Gallery.
Mr. Chair, through you, the National Collection at the National Gallery includes, is representative of all the national artists and not just Miss Lassie's collection. The CNCF has an output for the maintenance of the Miss Lassie's art collection, but the members' comments are noted, and I'm sure it's something that we can discuss with the CNCF and the gallery.
But
sorry.
Sorry to cut you, but Mr. Chairman, she has just said that the National Gallery is the collection. The National Collection is at the National Gallery. But in an answer prior to that, you said part of Miss Lassie's is at the National Cultural Foundation. So the national cannot then be, the National Collection of the Cayman Islands cannot be all at the National Gallery. I'm sorry, somebody need to explain that to me.
Natalie Urquhart, Director of the National Gallery, through you, Mr. Chairman. The Miss Lassie collection is currently part of a larger trust that the Culture Foundation look after for Miss Lassie's legacy, which includes the house, the artwork, and all the educational materials around her prolific artistic career. So that is quite an unusual circumstance in terms of how it's managed and maintained specifically by the Cultural Foundation. The National Gallery then is responsible for the ongoing growing of the National Art Collection, and we have about 225 pieces that we are responsible currently for looking after and preserving and exhibiting.
Yeah, but I am talking about those original paintings. If we want someone else to take care of the house and do the tours, I'm easy with that. I personally, this is now, would like to see those original pieces at the National Gallery, all in one spot. If we want to do prints, I'm easy with that too.
Noted, through you, Mr. Chairman. Noted, thank you. And we are in ongoing conversation about how to manage this larger national art collection, which I think has also been addressed in the cultural policy. So it's an ongoing conversation.
Because,
we'll commit to doing that.
Mr. Chairman, you do realize it's us who pay to keep it over there. So that means it's ours. That means we can put it where we think it's best preserved. And more people will see it. Because Hartwell Theatre, once every 2 months, people go to that. The National Gallery is where our tourists, our visitors are exposed to, our children are exposed to, and that's where Miss Lassie needs to be.
And Mr. Chairman, through you, if I may comment on that, we have been very fortunate to have a strong partnership with the Culture Foundation. And any time we do an exhibition of Miss Lassie's work or need examples in the National Art Collection gallery upstairs for the young people of the Cayman Islands, our community and the tourist visitor, they've been very, very kind at lending us any pieces that we need.
I put a question.
Mr. Chairman,
All those in favor
Mr.
of...
Chairman, I just have a few short questions.
Okay, go ahead, member from Newlands.
In the same vein as the museum, just staffing, Caymanian training and participation. What's your staff complement right now?
So we have 9 members of staff, one of whom is part-time, and then we also have a full-time paid internship, which is part funded by this grant and part funded by a private sector company. Part of that as well, we have a very strong creative careers program that we've been running now for about 4 or 5 years, which has consolidated our part-time work experience program. That sees about 50 young people coming through that program a year, including paid summer internships for any young Caymanian that is interested in a creative art career, and that's not specific to an art museum, but any type of creative career that it's a good starting point.
Okay. And of those, all those positions, how many were Caymanian?
All, but actually no, currently all. We had one part-time member who was on maternity leave who was doing our fundraising and development administration, who was from overseas because she brought these specific skills for fundraising with her.
Okay, so she's no longer here?
No, she's no longer with us.
Okay. Has that person been replaced? Or?
I'm currently doing the fundraising work. I have been, but because of our large reliance on fundraising, it's actually put 2 part-time jobs. So that's currently under my remit right now.
Okay, so that person no longer does any work for the museum?
No.
That's a key role. Sorry, I should be speaking through you, Mr. Chairman.
Apologies.
Is anything being done to make sure you recruit for that position as soon as possible?
Mr. Chair, through you, we are currently recruiting for that position.
Okay, thank you.
Mr. Financial Services.
Thank you, Mr. Chair. I just have a brief question. It's probably more geared towards the ministry, but I'm sure whoever is most appropriate can answer. The idea, and I think it may actually be captured in the cultural policy, but I know it was something that we had talked about, and as far as I understood, had kind of approved moving towards having an umbrella type of organization to kind of pull all of the cultural entities that we have just voted, and we've realized that there's lots of synergies, maybe lots of overlap, maybe lots of duplication, ways to kind of work to have a more effective, but also to get as broad support from fundraising perspective, but as well as exposure, because we just highlighted a situation with Miss Lassie's, and I just want to say for the record, I certainly support having Miss Lassie's work in our National Gallery as a part of the National Collection as well. But can we get an update as to where we are with moving towards that kind of an organization so we can maximize exposure, return, and ultimately cultural awareness in the country?
Mr. Chairman, through you, one of our plans for the coming financial period is to look at the operational plans under the Culture and Heritage Policy, and the question around whether what the best governance model, what the best delivery model might be for the very things that you raised, maximizing exposure, fundraising opportunities. Those are discussions that we envision having over the next year or so, and so hopefully once those action plans have been agreed and we're moving forward, we'll have a better idea about that. But that's definitely one of the things that's up for discussion.
And sorry, Mr. Chair, this is certainly an area that I'm very passionate about as well, is promoting our culture, and hence it's actually enshrined in our new education law as well. But can we get an idea as to who is going to be driving that initiative? Because obviously, as you can hear from a number of us in here, we're really keen to make it happen so we can, because we do have a mandate now to actually make sure that our children learn about our culture, heritage, and we need to do it as quickly as possible. So if you could provide the House with an idea of the time frame as to when you think we'll actually have a plan to work with and who is driving the process, I'd greatly appreciate it.
Mr. Chair, through you, the Deputy Chief Officer in the Ministry, Ms. Nancy Bernard, led the process with our steering committee, and there were a number of subcommittees that led up to the creation and formulation of the Culture and Heritage Policy. The Ministry's plan is to reconvene the steering committee and to draw also on some of the subcommittee members that worked on the policy to come up with some action plans. We're hoping to move forward with that within the first 6 months of the financial year.
Member Freestone.
Mr. Chairman, I want to endorse the member from West Bay. Which you from now? North? South? West Bay South. This art happens to be for the people of this country, but more importantly, the children of this country. The destruction of art is exactly how you destroy a whole country. That's precisely what Hitler tried. And you wipe a country out. And if you have it in 4 or 5 different places, your national collection, you are going to have problems. We need it in one spot where our children, it is owned by this country. It is not owned by any one individual. Yeah, but you need to preserve it to the point where, protect it to that point where fire, storm, hurricane, nothing can reach it. And if it means we gotta go down by the National Gallery and build a building that protects that, that needs to happen. We are so lax with preserving our heritage. That's why we have not done enough of it. And that's why we don't have enough of it. And there is so much that reminds us, that is available to remind us of where we came from and who we are. And if we lose the opportunity, future generations will never, ever know.
Through
Let me
you,
put the
Mr. Chair,
Go ahead, sir.
I take on the members' comments very seriously.
Okay. Thank you, sir. All those in favor of NAG 1, Exhibitions and Collections, $169,940 in 2018, and $169,940 in 2019. NAG 2, National Art Collection, $120,620 in 2018, and $120,620 in 2019. And NAG 3, Art Education and Outreach Programs, $295,440 in 2018, and $295,440 in 2019. All standing part of the schedule to the bill, please say aye.
Aye.
Those against, no. The ayes have it. NDC 1, Policy, Prevention, Surveillance, Research, Information, Monitoring, and Evaluation, $637,000 in 2018 and $637,000 in 2019. Are there any questions? If there are no questions, I put the question. All those in... Okay.
Yes, Minister. Thank you, Mr. Chair. Mr. Chair, if I could just get an overview of, I guess, the work that the NDC is doing, and in particular, if there is, I know they do some research in the prison itself, but to give a bit of an indication about, like I said, some of the work that's being done to not just conduct the research, but I guess implement the findings and how we're actually moving the issue of dealing and tackling with drug abuse, drug prevention, drug addiction. Thanks.
Joan Westakers, Director with the National Drug Council. We don't only conduct the prison survey, we've been conducting the school-based survey since 1998. It's a cycle that's done every 2 years. The last piece of research would have been done in 2016. Where we look at the growing trends and we look at the patterns in substance abuse amongst our youth. That is a survey that's conducted years 7 through 12, all public and private schools, Grand Cayman and Cayman Brac. Right now, we're the only entity in the schools providing any prevention, education, and awareness programs. We also do community-based work, as well as education and awareness programs within the prison. We're responsible for data collection with the aim to develop programming and policies throughout our communities. We work with stakeholders to help them implement their own programming. We develop our programs in-house based on the data that we have collected. Our presentations are based on the findings of our research and not sort of ad hoc and taken from other jurisdictions.
Thank you, Mr. Chair, and thank you for that answer. That's very helpful. In terms of kind of measuring the impact that you're having, because obviously we know we have a concern about, drug abuse in the community, and we have a concern that it's actually growing amongst younger and younger populations. So how do you have within your data collection metrics, how do you, I guess, work collaboratively with the other agencies that are would be supporting the idea of tackling and dealing with drug abuse prevention as well as intervention? And how is it that we're measuring success, or conversely the lack thereof, in this space?
Through you, Mr. Chair, that is a problem or a circumstance that's bigger than survey and the work of the NDC. It's a national responsibility, which would require some strategic work across entities. Our proposal is for a national anti-drug strategy to be managed by the National Drug Council, which would allow us to have the KPIs, the monitoring and evaluation systems in place to determine any successes. Successes cannot be done in isolation or seen in isolation. And the work that is done by the NDC is by a limited staff across a small segment of our population and does not cover everything from prevention at the early stages back into rehabilitation and reintegration into our communities.
Are there any other questions? Minister?
Thanks, Mr. Chair. I was just wondering if she could inform the committee as to the trends that you found on the BRAC in particular in the last year.
The BRAC in the last few cycles have seen increased drug and alcohol trends, as we've seen in other segments of our population. In addressing that, what we did is we've actually got a full-time staff in Cayman BRAC, and that is a population that will be easier managed and monitored because we know what programs we've put in and we know what we're doing in the BRAC. Our aim is to see what outcomes there are in the upcoming survey to see if anything that's been put in place has mitigated the problems at any stage. The drugs of choice are primarily are alcohol and marijuana in the BRAC, as they are here. Marijuana and alcohol.
Mr. Chairman, sort of in the same vein as your last comment, the drug use here in Grand Cayman with our young people, are you seeing trends indicating that new drugs are now coming into our jurisdiction and being used significantly by young people?
Through you, Mr. Chair, there's no significantly new trends in terms of drugs. We get our primary drugs of choice are marijuana, tobacco, alcohol. There is periodic use of other substances, ecstasy, we've had magic mushrooms, we've had amphetamines. We manage and monitor those based on our work in the community. So the survey is not a stagnant instrument. We review it with stakeholders based on our work in the community and based on feedback. We will ask questions around any other substances that may be trending, either in our jurisdiction or other ones, to be able to capture any information that might be relevant to our population.
Thank you. And Mr. Chairman, on a scale of 1 to 10, 1 being not alarmed, 10 being extremely alarmed, where are we in terms of drug use among our young people?
Through you, Mr. Chair, there's not really a benchmark. Our trends are growing in the same manner as we are seeing in jurisdictions around us, the US and Canada. I think what we're looking at in terms of how we can start looking at being successful is really implementing programming and policies that will mitigate some of the negative impacts in our communities that we're seeing and driving incidents of crime and incidents of arrests throughout our communities, whether it's youth or adults.
Thank you. Mr. Chairman, I want to ask a tough question. How long has NDC been in existence?
Through you, Mr. Chair, since 1998.
And you just said, Mr. Chairman, the answer I just got was that we need to start implementing these preventative measures. Is that accurate, or did you sort of misspeak?
Through you, Mr. Chair, I'm not misspeaking. What I'm talking of is a greater picture. There are some programs being implemented. There's some ad hoc programs being implemented. It's not the role of the NDC to be the primary program provider for our communities. We need to have a strategic approach to programming and policy. It's not just about what programs are being put in place, but what policies are we implementing that will reduce the impacts in our community, what areas of legislation, and whether it is a prevention-based initiative or if it's a rehabilitative approach from a reoffender. How do we close gaps and work in a continuum of care that is going to be meaningful to our population?
Thank you. How much is the NDC being, Mr. Chairman, how much is the NDC being consulted when we bring forward changes in legislation and new policies, especially affecting young people? Is there a high level of consultation, or is not much happening in that area when it comes to your involvement in these activities, these initiatives?
Through you, Mr. Chair, our involvement has increased in the past few years. We are being asked for more feedback, and generally, if we're not asked, we will provide our feedback once we know that there is an opportunity. So if there's a policy under review or a law under review, or even if we see things captured in the media that raises our awareness or raises our attention to a particular issue, we will bring to the attention of the relevant ministry or entity our concerns, and being able to provide that information around local statistics has been important to us because we can speak to what our communities are facing.
And last question, Mr. Chairman, is your organization actively involved in the schools? When I say the schools, I mean the education department, the Department of Education Services, I think it is now, in terms of making sure that at that level, at the school level, we are implementing preventative measures to turn our children away from drugs and drug abuse and in the right direction. Because I've become really alarmed. The opposition members have visited just about every school in Grand Cayman now, and on most of those visits, I asked students to raise their hands and sit and to indicate that they know someone who uses marijuana or who drinks. And you can ask the members behind me, overwhelmingly, just about every student wants to raise their hand. So to me, I know the surveys indicate one thing, but the trends seem to be much worse than that in reality, because these young primary school kids are raising their hands. It may be an adult that they know. I tell them, don't identify anyone, don't say anything, just raise your hand. But it's alarming. But are we doing enough in the schools?
Through you, Mr. Chair, our involvement in the schools are at the request of the schools. It's not mandatory for students to be provided with that level of service through our organization. What we've done is taken an approach where we reach out to the institutions and provide the services as needed. You will note, however, we've gone from something like 35 presentations in a year 8 or 9 years ago to over 600 already this year. So the demand is increasing. We're in most public high schools, several of the private schools, and we have started work in the primary schools, which wasn't happening at all. So with the increased staff that we got last year and placing one staff member in the BRAC, what we've done is we've looked at increasing services in the primary schools, primarily starting at grade 6. That way, when we're conducting the surveys starting at grade 7, we're starting to be able to look at any changes in behaviors and attitudes. I don't think that what you're hearing is any different from what we're seeing in the surveys and in any anecdotal responses that we're getting in our classrooms or in our settings. It's a continued, we've seen the trends over the years, and I think our survey is valid because it's not the same children being surveyed in every cycle or in the same age group. And if you look at the patterns, you will see that there are some areas to be concerned about, and education is going to be the key in mitigating.
Mm-hmm. Thank you. I wish you well, and you have my support.
Member?
I do have a follow-up based on the questions and answers, and given the answers, really, I guess it's a call for action more than anything else to make sure that the strategy that you're talking about is actually developed and implemented post haste at this point, because we see it on the ground, what is happening with the children, with the community at large. And as you said, I mean, I think the member asked about the length of time that the NDC has been in place. So we've been gathering the statistics for a while. We just now need to make sure we do something about addressing it. And certainly, my question that I have to ask is, to what extent do you work with other agencies, either within your own ministry or other relevant ministries that are charged with the mandate of dealing with drug abuse, prevention, intervention, rehabilitation?
Through you, Mr. Chair, we work pretty closely with all of the other relevant entities, whether in our ministry or otherwise. One of the benefits of the organization is we've had an open relationship in terms of getting people to understand our role and our function. And one of the things we've been trying to do for the past few years is collecting data that will speak to sort of the holistic view, what is happening in our country, whether it's demand or supply reduction. We have constant contact with police, immigration, as needed in terms of data collection. If we're looking at reviewing policy, we will reach out to the relevant entity. One of the things that I can say is coming out of strategic documents in the past, we've had some great successes. If you look at the partnerships that we had with Customs and we look at the screening machines that they got, that was through a process with the National Drug Council. Some of the legislative reform pieces, when we look at the work with, even within the prison uses the data from their survey to start looking at what policies and programs to implement. And the data isn't about who's using and who's not using. It's more about what do we need to do in order to strengthen some of the areas of our communities and really address the weaknesses and reduce some of those negative impacts that we continue to see resulting from issues related to illicit and illicit drugs, because we do look at not just marijuana, cocaine. We're concerned about tobacco and alcohol in the same way.
Thank you, Mr. Chair. And again, just want to reiterate, I guess the KPIs, as you referred to, the actual being able to measure success in the initiatives. As you said, demand has been increasing for presentations and the like, but we need to make sure that that we're getting and we're measuring how effective. And I mean, this is a general statement across the board for any of these social programs, but in particular with any of our drug-focused programs, because the problem just seems to be getting greater and greater. And I take your point. We're not the only country dealing with this. So I certainly support the initiative that you've outlined about creating this kind of overarching strategy, making sure everybody's feeding into that. So we're working towards the prevention, intervention, rehabilitation in a seamless way. And as I said in my debate, I certainly will be encouraging even more so the people in the prison in particular to ensure that we're working very collaboratively with the other agencies to put a proper intervention program in the prison, because that seems to be lacking as we speak.
Thank you, Mr. Chair. I want to say that this is a very important item, and it's every parent's nightmare. And we not only need to say don't smoke, don't drink, but find avenues as a country, as communities, for young people, which I'm most concerned with, to have options. Thank you.
All those in favor of NDC 1, policy, prevention, surveillance, research, information, monitoring, and evaluation, $637,000 in 2018 and $637,000 in 2019, standing part of the schedule to the bill, please say aye.
Aye.
And those against, no. The ayes have it. Members, this is a convenient time for us to take the evening break. It is now 6:27. We'll reconvene at 7:15.